Well, thank you very much for having me back again. I love this stuff. I love talking about research and I love talking about nursing. So, you know, this works out well. I get to talk about both. So, as your professor mentioned, I have a dual role. So some of the time I'm at Xavier and some of the time I'm here. My job here is to be a mentor and support for the nurses who are working to develop either research projects or evidence-based projects. And I just love it. I get to go out and visit the units and hear about what kind of problems they're trying to solve with research. And I'm just amazed at the high-level things the nurses are doing. And so it gives me a great deal of pleasure to go out and visit these units and listen to what the challenges are that these nurses are facing and to help them solve those problems through evidence-based practice. So today we're going to be talking about posters, though. I've presented a number of these. I'm a PhD student myself right now. I am at the University of Hawaii as an online student, and my dissertation area is the informatics competencies of nursing students before and after completing an online tutorial training course on informatics. And so I've been doing this for a number of years. I'm in the 6th year of this PhD program, so I'm growing really weary. I know you understand that because you're probably growing weary too. So I applaud you for being here. You are among the few who continue on to get more and more education, and so I applaud you for that. Come on in. Those who go on to get advanced degrees in nursing, whether that's going on for master's or doctorate, very small percentage that do that. So I love to see that you are here, that you are continuing your education, because we have so much to offer to our patients. There are so many clinical problems that nurses own that we can have a voice in and we can impact the health outcomes. And so the more education that you get, the more you know about how to do research and how to be directly involved in things that impact patient care. Although it doesn't take a PhD to do that. Sir, I've known many associate degree prepared nurses who are just dynamos on their unit in identifying clinical problems. So, of course, now we're going to talk about posters, though. And my question to you, I tend to be kind of interactive. Actually, that's not true. I tend to be very interactive. So I'd really like for you to talk to me, because if you don't, I'll come over and talk to you. So just talk to me, because otherwise I get kind of lonely up here. I want this to mean something to you. So when I talk about examples, tell me what you're doing, because I want you to walk away from this session with ideas for your own poster. And that's the point of my being here, is to help you. So talk to me throughout this. Don't hesitate to raise your hand or yell out if you have a question or you have a comment. So why do we need to do posters anyway? I mean, really, what's the point? So this is the interaction part. Why do you think we need to do posters? Visually for what?
Education. People are visual learners.
Okay, so for people who are visual learners, they can look at this and get something out of it because they're visual. Okay, what else?
It's a quick way to get your point across of the information you want to share in a short amount of time.
Very good. Yes, both of those are very good. It's a way to get out a message that's very concentrated, to the point, succinct. You've got a short message you're delivering that packs a wallop when it comes to the message that is there. And so you're able to get that message out. How many have you attended a poster presentation, a professional poster presentation? So just a few, just 3 or 4. Okay, great, I'm glad. What I have to say to the rest of you is, you gotta do this. It's cool. It is. I love going to poster presentations because you've got this room that's just full of knowledge and experience and researchers at all different levels. And the really neat thing about it is when you go to these poster presentations, you can go through the list prior to the poster reception starting and see what areas interest you and highlight them, those that have a similar, either research interest or evidence-based interest to your own, and then you go find those folks and you can learn so much, and it will inform your own research interests, or you may even find someone that you can collaborate with. I've seen that happen many times. So yes, both of those things are true. It does create a source of information that is in a summary format. So it's not lengthy, it's to the point. And in today's information age, when we want it and we want it right now, these things work great. It's also a very efficient communication tool because think of how many posters you have inside a room at a time, and people can just move right on through. It's very efficient. And it gives an opportunity to network, as I mentioned before. But also, this is very important. For you, if you are the presenter, what a great opportunity to disseminate the work that you've been doing. I mean, how terrible is it to do a really cool project and then no one know about it? So nurses have a responsibility to disseminate the findings from their research and from their projects, because otherwise, how can we ever promote the best evidence and practice that's going to give us the best patient outcomes if we're not sharing this stuff? We have a responsibility to do that. And I can tell you, once you've done this a couple of times, you start to get the bug, because it's so exciting and fun and to be in that environment. And then you find that you want to do more and more with it. And that's where I come in. That's what makes my job so great. It's such a fun, exciting way to disseminate nursing knowledge. So the purpose of my time with you today is that by the time you leave here, my hope is that you'll be able to discuss the factors that you need to be considering as you're working to develop your poster, that you can describe the roles and responsibilities of you as the presenter, that you can identify the elements that constitute a professional poster, and then demonstrate an effective presentation style, which is very important. I'll get to that in a few moments. So, why do we need them anyway? Well, we've covered that well. We need to get a message out. What is the message? And that's what you need to be thinking about now as you're working on your projects. The content, the other part. So we've got the key message, which is usually conveyed in the title or the topic that jumps off the page at you, jumps off the poster. And then the content, which is what the poster is comprised of. And then the delivery. This is what I don't want you to do, okay? I don't want you to ever do this. When you're presenting your poster, I see this all the time. Now, how many people are going to walk over and look at my poster when I'm standing in front of it? Don't do that. Get to the side of your poster. And then when you see people who are making eye contact or they seem interested, welcome them, encourage them to come. I mean, you've done so much work to get here. And if someone might be interested and all it takes is your welcoming invitation, do that. Encourage them to come. That's that number 3, that delivery style. If you're going to go to all the trouble to do the project, get accepted to present, create the poster, arrive usually in another state at a conference, don't just stand in front of your poster with your hands together. Welcome people to come and enthusiastically share what you've been doing. So the content, this is broad because when you're reporting on a research project, it's very different than when you're reporting on just an evidence-based, I didn't mean to say just, they're all extremely important. An evidence-based project, though, has a bit different reporting structure. So keep in mind that I did this is broad. If you were doing a research project, like when I report on my dissertation, it will be much more extensive than this. So the key content areas are the title, of course, The purpose. We're going to spend a little time talking about that because that is critical. The background, the methods and design, the results and discussion of your findings, and the relevance to nursing. Now, your instructors have this PowerPoint, and they are welcome. They have my permission to post that for you so that you can see all of these things I'm talking with you now. So you're welcome to take notes if you want, but just know that you will also have access to this PowerPoint later. Okay, so the title. The title should identify the overall gist of your project. It should be very clear, easy to follow, concise, easy to read and follow. So you don't want a title that is 3 lines long. You've already lost part of the audience by the time you do that. It needs to be, keep in mind, when you're doing this, feel free to come on up. Come on. You're in a room with dozens, maybe 50 or more other posters. So there's some competition, really. And there's not usually a whole lot of time, and people are filtering around, right? They're just walking around. What do you think is the average amount of time that you have when you finally get them over to your poster? You know, you've noticed that they're looking at it, and you encourage them to come on over, and they're standing here looking at your poster. How long do you think is the average amount of time that you have them in front of your poster? 2 minutes is the average. 2 minutes is what you got, if you're lucky. If you have been successful in attracting their attention and getting them to come over and take a look at your poster, and it's easy for them to follow, then yeah, they'll stick around maybe a little bit longer if it's a topic that's really of interest to them. But it's 2 minutes. So it starts with this title. That's what's going to catch them from across the room, is that title. You want to use active verbs, and again, not too long. You want to be able to see it across the room. The purpose of your poster should be abundantly clear. I brought a couple of examples here. This is a nice poster, but what's the first thing that you think about when you look at it? It's what? It's neat. It's got, and yeah, I'm glad that we're talking about this now, because then as we start talking about these elements, then I think some of these are going to start to really resonate with you. So it's very orderly, isn't it? It's got an order, a flow to it. What is the flow? There you go. Yeah, so your eyes go down, left to right, right? Down, left to right. And that's what we want it to do. A lot of times you'll even see posters that actually have lines and grid lines. And that's okay too. What else about this poster do you notice?
It had research on there.
It's got research on there. It's got, we see graphs and charts. People love that stuff. They really do. So why put in a bunch of words? What you can summarize, I mean, what this says by looking at these graphs and charts would take a whole page of text, wouldn't it, to explain. So anytime that you can use graphs and charts and pictures and tables, that's the way to go. You want to use those, but we're going to talk some specifics about what to consider when you use those. So getting back to the purpose, though, the purpose of the presentation, you want the viewer, when they come to see your poster, to not have any doubt as to what your poster's about. Now that sounds like, well, duh. That makes sense. Of course, we want them to know what my poster's about. But it's not always so easy. Because sometimes folks get off on all sorts of tangents with their poster. I recently worked with someone who completed her dissertation last year. And she has a document that's 250 pages long, and about 30 pages of that were graphs and charts and tables. And she was just trying to pack as much as she could because, and I get it, I understand, she worked hard on that stuff and she wanted it in there. But that's not the purpose of a poster. The purpose of a poster is a snapshot view of a portion of your project that you can convey to your audience with the time and the resource, that being a limited size of a poster. And when you try to start stuffing too much stuff in there, it loses the effectiveness and the impact, and therefore you can't meet your purpose. So you're going to hear me say a lot of times throughout, come on in, that you need to limit content. This is not, and so that's what I would say about this one. It's a little too wordy. There's a lot of words going on here, and that's okay, but it's just a little hard for the eye to follow. So your purpose statement should be so clear. So Cheryl, she's was one of my students at Xavier who graduated a couple years ago, and she gave me permission to use her poster. She did a fabulous job with it. And her purpose was to increase the use of smart phrases among RNs within a fast-paced pediatric emergency department. Well, that's pretty clear, isn't it? We know what she's going to do, we know who she's going to do it with, and where she's going to do it. That's what you want. It needs to be clear, concise, succinct, and leave no doubt as to what is the purpose. Then, as you're considering what your purpose statement is going to be, you know, I would say that with nurses that I work with, this is probably the part that is the most difficult. And that is figuring out what is the purpose, what is the problem. I say this, I would say since I've been in this role, 100% of the time, when I have gone to talk with nurses about their projects, 100% of the time I've needed to say to them, have you defined the problem? Do you know what the problem is yet? And oftentimes they look at me like, well, yeah, I just told you what the problem is. The problem is we have a lot of patient falls on the unit. Well, a lot does not define the problem, right? So if you don't define a problem before you jump in and start fixing it, which as nurses, that's what we love to do. We love to fix problems. So we tend to just jump in and start doing it because that's what we do best. We just fix stuff. But then we have quite possibly contaminated our sample. So we always want to define what is the issue that we see as the problem. So for example, my dissertation is on the informatics competencies of nursing students before and after training, informatics training online. I mentioned that before. So if I just decided I was going to go in and just deliver this intervention, then how am I going to be able, well, let me back up. How am I going to know if I'm looking at the informatics competencies of nursing students? How am I going to know, let me put it this way. What should I be measuring? If I am looking at, does my online course, does it improve the informatics competencies of nursing students? If I'm going to define the problem, what do I need to know? Say it again?
I'm computer literate.
Okay, what's their competency to begin with, right? Yeah. So I got to have some kind of tool to measure that, which I do, by the way. It's called the Self-Assessment of Nursing Informatics Competency Scale, and it was developed by a researcher, Dr. Sun-Moo Yoon, out of Columbia University, and she's on my dissertation committee. Isn't that cool? I mean, she's published numerous articles, and she is a preeminent nurse researcher. And I asked her to be on my dissertation committee, and she said, yes, I just about died. But I'm thrilled, and she's just a wealth of knowledge. But the point being that first I had to define the problem. I needed to know first, what are the informatics competencies of nursing students before I do my intervention? Right? I needed to define that. Because otherwise, if I just jump into my intervention, how am I going to go back and find out what it was? Because it's too late. So as you're working on your projects, think about that. Define your problem first. What is it you're trying to solve before you start solving it, so that you can show that what you have done has made a difference. Now, I know that's not necessarily about post